Hi, Dr. David Schiller here, and today we're going to be continuing our discussion on fibromyalgia as it relates to brain fog. Now, very common symptom. It's common to people that have fibromyalgia. It's common to people that have thyroid conditions, one of the most common symptoms of thyroid. Now, I have numerous posts on thyroid. Go take a look at them. But just know, the majority of thyroid problems are an autoimmune disease called Hashimoto's. So for many people that have fibromyalgia symptoms, and as it relates to brain fog, may have an autoimmune condition. But brain fog in general, brain fog can come about in different ways, or it's expressed in different ways, where it's the person who walks into a room and forgets why they walked in there, to the person who can't remember what they're doing that day as they're doing it, or they forget things that they just heard 3 minutes ago, or that they have an inability to remember where they put their car keys. Anyway, the brain fog is a condition by which the brain is getting inflamed. There's inflammation that's running rampant in the brain. As far as the memory goes, there's a part of the brain in the temporal lobe area called the hippocampus, and it is notoriously susceptible to cortisol fluctuations. So, think about it. Fibromyalgia, lots of pain. Lots of pain, we know the inflammation is out of hand. Inflammation is produced in the body and eventually gets to the brain because of different categories of cytokines, which are inflammatory markers. They pass through and get to the brain. The brain has an immune system that's very general in nature, so once inflammation is triggered in the brain's immune system is called into action, and it just starts to tear apart brain tissue, literally. So cortisol is the notorious culprit for this, cortisol being the production is produced by the adrenal glands. The adrenal glands are dealing with inflammation. The adrenal glands are dealing with blood sugar balancing. The adrenal glands are dealing with producing precursors to your sex hormones like estrogen and progesterone or testosterone. So the adrenal glands are involved in a lot of different things. The adrenal glands, if not working efficiently, will not allow inflammation to be squashed, which will bring out the pain, but then also can produce the situation where parts of the brain that are susceptible to cortisol, like the hippocampus, where memories are produced, it starts to become attacked. So the brain fog is a product of inflammation in the body that eventually gets to the brain. Now, for many people, it's very scary because they start thinking, okay, they're in their 30s, they're in their 40s, they're in their 50s, and they're starting not to remember things. And just remember, whether it is the brain fog just from a fibromyalgia situation or from a thyroid situation, the idea is that the brain fog can be precursor to dementias later in life. So just keep that in mind when you're making decisions on what to do about it, that you should intervene as quickly as possible because you want to make sure you're taking care of this. So regardless of whether you want to tag it to a later in life disease, doesn't matter. If you have brain fog now, it's affecting you. It's affecting how you think, how efficient you are in your day-to-day activities, how you deal with your family, how you deal on your job. So just know that these situations are a sign of some other underlying condition, and that's what you want to get to. Getting it evaluated is what is appropriate. Getting to the bottom of what may be causing the brain fog is what is appropriate. So taking a medication just to clear up your head without taking care of what is causing it is not the way to go. You have to find out, well, what is causing the brain fog? Is my brain fog being caused because I have adrenal glands that are not working well, my thyroid's not working well, I have blood sugar imbalances, or is the brain fog being caused because I'm not oxygenating very well because I'm anemic? Do I have an autoimmune condition? I mean, what's going on? This is what you have to find out. Don't just treat symptoms because that's not going to get you anywhere, and eventually you're going to land in a place where you don't want to be, where it's too far gone. So keep that in mind when you're picking a doctor. Make sure that it's a doctor that will get to the cause of the problem so that you can actually start feeling better, get back on the road to health again. So I hope this helps, and look for my future posts on this topic, and make it a great day.